Okay, welcome everyone. We're really excited for our education panel tonight. I appreciate everyone who's attending with us in person. This is the first time that we've ever offered anything like this, so we're excited to kind of hear your feedback after. But we're here for an inside look at advancing your CEP education. I want to thank our panelists for taking the time to be with us, and I'm looking forward to kind of seeing what they have to share and also the questions that you have for them. We have a couple questions pre-planned to kind of cover various topics within kind of CEP, advancing your education, certifications, things like that. So please add your questions into the question function, and we're going to try and get to as many as we can at the end. But to start out, I'm going to give each of our panelists a minute to kind of give us a brief intro of who they are, where they're at. We chose these panelists because they were supporters of our annual conference this past year. So we think they're institutions also for supporting CEPA and the things that we're doing. So we're going to kind of round robin through our panelists for their intros. Nicole, let's start with you.
Hello, good evening, everybody. I'm Nicole Kuntz, and I'm from Ball State University. I've been at Ball State since 2011, and I've held various roles. My current role is I am the interim director of the graduate program in the adult physical fitness program and our clinical exercise physiology program. And I also graduated from our program back in 2006. And I worked at a hospital in cardiopulmonary rehab for about 5.5 years before coming back to Ball State.
Thank you. And Brittany, I'll have you go second.
Hi, everyone. Thanks so much for joining us. My name is Brittany Overstreet. I am a clinical exercise physiologist and an associate professor at the University of Delaware. I got here by obtaining my bachelor's degree at Salisbury University in Maryland, got my master's degree at Ball State in Indiana, and my PhD at the University of Tennessee. At the University of Delaware, I teach undergraduate and graduate courses, but I'm also the program director for our master's in clinical exercise physiology program. So this is year 9 that we're in right now, and we've been very proud of the program we've been able to create. I'm excited to chat with everyone tonight.
Thank you. And lastly, Jamal.
And Sadie, thank you for the invitation to be a panelist, and good evening, everyone. Thank you for tuning in and watching. I'm Jamal Ozamek. I'm a clinical associate professor at the University of Illinois at Chicago, where I serve as the program director for the professional doctorate in clinical exercise physiology, as well as our medical exercise therapy clinic. The way I got here is I originally from California, did my undergraduate in exercise biology at University of California, Davis. Then did my master's at Wake Forest University in North Carolina, did my PhD at Ball State, so common theme here, and then went off to do a postdoctoral fellowship at the University of Colorado Medical Center, where I realized I wanted to come back and have more of a clinical presence in my career, in addition to research, mentoring, and teaching. And UIC was able to give me that. And I'm very excited that we're in our 3rd year of our professional doctorate program, and looking forward to talking more about that towards the end of today's conversation.
Thank you. So like I said, we're going to kind of do a round robin with our questions as well, kind of having a core person answer each one. I'll kind of open up the floor if we have time after that answer, if anyone has anything else from our other panelists, if they want to add. So we'll round robin those, but feel free throughout to put those questions in that question function. So Nicole, you are up first, and our question is, do you have any advice of what helpful undergraduate coursework people should be thinking about taking, or internship experiences that would then help them for their master's program? So coursework or internships to prepare for a master's degree.
Great question. I think a class in exercise prescription would be great if that is available at an undergraduate level, as well as an assessment course. Sometimes those courses are combined depending on the university. An EKG class, of course, would be beneficial if somebody is interested in the clinical exercise physiology route, specifically with cardiopulmonary rehab or CPET testing. As far as internships are concerned, I would say it really varies depending on the route that the student wants to take. If they are interested in the cardiopulmonary rehab, bariatric oncology rehab settings, obviously an internship in those settings would be great. Doing as many observations and seeing as many diagnostic procedures and assessments would be helpful as well to get a background as far as what students are, or what patients, excuse me, are doing prior to going to the cardiac rehab facility in particular. But I think that it just truly depends on what setting the student wants to take long term. If it's more of in a clinical setting, if it's more of a research background. So the internships can vary depending on what that might look like in their future.
Thank you. And I'm going to open it up if either other speaker has anything to add. Um,
Yeah, I think I completely agree with everything Nicole said. The only thing I would add is, thinking about my own personal experience in seeing students that have been successful through the graduate school experience and often to their professional career. Typically those that take, a traditional pre-med route. So you're taking a lot of science-based classes that are very rigorous. Um, we may not be using the full breadth of information that we acquire from those higher level courses, but those courses at the undergraduate level truly prepare you to be successful at the graduate level because you're used to the rigor. You have great foundation in just cell biology, physiology, human anatomy, etc. So really try to choose a challenging pathway and don't look for the path of least resistance.
yeah, I
Definitely
definitely think
agree
that's,
with both of the.
no, you're good. You
Oh, go ahead, Sadie. I was just going to kind of throw a curveball into the suggestions here with that. So obviously, it's going to vary based off of the offerings at your institution and the university as to how many unique classes you can take. But one thing that I would encourage students to consider, if you have the opportunity, is to take a course that enhances your ability to communicate with other individuals and learning how to really come across challenging conversations and even challenging moments. At the University of Delaware, we actually have a program called Healthcare Theater where actors will come in and pose in different situations, and students have to learn how to overcome those challenging situations, have those hard conversations. And so I think that that would be very successful because anytime you are going to find yourself working in a clinical exercise physiology position, you're going to find yourself working and talking with people all day, every day. And those questions and knowing how to ask proper questions really makes a big difference, not only with your rapport with patients, but also your ability to gather information and best serve them.
Yeah, I think that all as a clinical exercise physiologist working in the clinical world, love all those thoughts. I think to Jamal's point, when you have that deeper understanding, especially when you're explaining things to patients, sometimes they want to know a little bit of the like science, and then you have to make it patient friendly, which is then what brings in that communication piece of it. Learning what we know in the classroom, but then being able to communicate it to people. So really great suggestions on that one. For our next question, I'm going to give it over to Brittany to start out with us. This question is, why would you pursue a master's degree? What are the additional benefits for jobs, compensation, and just kind of taking that next step in someone's education?
Yeah, absolutely. So obviously, this is going to be a personal question based off of your own factors, what's going on in your life, and what path you want to pursue, either before or during or after an education program. One of the things as a program director that I've seen with my students as they go through the beginning to the end of a program is that a master's program really helps them prepare for a little bit more of the unexpected. It also prepares them on the job market for the difference between the required requirements in a job posting and the desired posting requirements. And so with that, if you've looked at any job posting, a lot of times they'll have X, Y, and Z that you must have in order to just meet the minimum qualifications for the job. But then at the very bottom of the job posting, they have their desired, which is going to give you an edge in competition as far as fighting with another individual who is also looking to obtain that position. Many of the times, what you'll see in positions in cardiac rehab, pulmonary rehab, I know it varies across the country wildly, but from what I've seen in recent years, a lot of the minimum requirements would be a bachelor's degree with so many hours or years of experience, but the desired is the master's degree. And coming with that would be the certification, whether it's coming with the individual or obtained within a certain amount of months after you get the job. We'll talk about that in just a little bit, so I don't want to get too far ahead of myself, but a lot of the preparation that you would do at the graduate level would give you additional hands-on experience from what you already have, that deeper level of science and communication skills, which we just mentioned a little bit about. It would help you be more competitive across the field because you might be competing with 20 people, you might be competing with 200 people, you just never know. And as far as compensation, there are varying levels and positions. It's going to be a little bit more dependent on maybe the hospital or even in academia, where you're starting and coming in. I would imagine that the master's degree does provide a little bit of a benefit with that. And Jamal, I'm sure, will maybe speak to what the DCEP might provide in those, because I know he has some information and some research on that. But really just giving you that additional experience to be able to handle more complex cases as the individuals in our country continue to get more sick. There's only more things to consider with our patient populations. People are not coming to cardiac rehab with only cardiovascular disease. And maybe in your undergraduate experience, you only got experience with a particular population. So being able to increase the diversity of patients that you work with and just understanding the pathophysiology and all of the underlying conditions would really be something that would make you stand out in the job market. But then again, as I mentioned before, be able to serve your patients better. So in short, I think that one of the biggest benefits to a master's degree is not only to further and deepen your education, but to also help you move from the required checklist on a job posting to that desired and make you more competitive in the market.
That was great. Thanks so much. I'll open up any additional thoughts from our other panelists.
I can't top that. That was perfect. Yeah, very comprehensive.
Yes. Fabulous. Jamal, you are next. Then when going and applying to graduate school, how should a student set themselves apart? And what are some typical admissions requirements?
Yeah, I think this is probably an important question for, before they apply. What should you do? What should you look out for to set yourself apart? And so, in addition to what I had mentioned earlier about, pursuing rigorous courses and showing that you can handle a pretty heavy course workload, in addition to other experiences, many universities' undergraduate programs will require some type of internship, some type of clinical experience, just to be able to get some hands-on experiences. Go beyond the minimum. They'll say you would have to acquire X amount of hours, and that could be easily obtainable. But typically, if you want to be competitive, you want to be an individual who's actively seeking out additional experiences. And it doesn't necessarily have to be within clinical exercise physiology. If you have a passion for performance training and you're working with collegiate athletes or high-end clients that are able to hire on personal trainers, all of that is beneficial because you're showing that you are a responsible professional. You're able to think outside of the box with your exercise prescriptions, and you're able to juggle a whole lot: work life, clinical internships, didactic school work. And so when we're looking at applications, sure, you got to get a good GPA. GRE scores, many programs are going away from that. Some programs still require that. So really studying and getting good scores on that are just given. So those are kind of the check boxes similar to what Brittany's talking about in the job market. But it's going above and beyond and showing that you have taken the initiative to do these other experiences. And if that requires taking a year off, then that's what it requires. I think you grow as an individual, you get more experiences to be able to then apply for the program that you want to be at.
Wonderful. Any additional thoughts from other panelists? Okay, we'll keep moving right along. Nicole, now that those people have thought about their requirements and kind of moving forward, what should they look for when they're choosing their master's program?
I think when choosing a master's program, many topics will come to mind. One is, what is the program offering? So is it just exercise physiology? Do they have or clinical exercise physiology? What that might look like? So the focuses, the concentrations, if that is an option at those particular places. I think the length of the program is also really important. Some programs might be a year and a half, almost 2 years. So that can look a little bit different, and that might be a barrier for some folks, but for others, it might be something that might be of interest to them if the program's longer or shorter, depending on that individual. I think assistantships also play a role in looking into graduate programs because I'll just speak for myself, for example. I went to a very small school for undergrad, and so for me, I didn't necessarily want to add additional student debt to what I already had on my plate. So I think an assistantship in my particular case was really important. And I think for many other students, the same thing would apply. So being able to look for those opportunities when they are available, and sometimes those might not be as direct as you might think. There are other opportunities sometimes within the universities or colleges that you might have to dig a little bit deeper. It may not be directly in your program of study, such as clinical exercise physiology. It might be another place on campus that may allow you to be able to have that assistantship and get some help with maybe student waivers, tuition waivers, and or potentially stipends. Um, and then I also think, just in general, going back to the type of program, is it a more of a clinical route? Is it a research route? Are there options to be able to take those different tracks, and what that might be of interest to you moving forward as you go into the graduate programs? And then I really encourage students to visit. I think visiting in person as much as you possibly can is really important to be able to get a feel for just, do you feel at home at that particular place? You're going to be there for X amount of time. And how do you interact with the faculty members, maybe the administrative coordinators, other students, being able to have those conversations with those individuals? Hopefully the students will be honest and be able to say, like, yeah, some days you are here for 10 hours. That's maybe not every day, but just being honest that way. And then if you're able to go to a class, and maybe seeing all the different sites that you might be working at as a graduate student, or at least working in as a graduate student.
Yeah, 2 points I want to emphasize there. So related to the research component of it. So when I was going through my process of where I started to where I am today, I knew I enjoyed research. Did that in undergrad, master's, and PhD. But as I went into the graduate arena, got more hands-on experience in the hospital, in the clinics, and really had a passion for that as well. And at the time, I thought, well, this is really challenging. I don't know which one to pick. Do I want to go off and become a researcher, traditional faculty at a university, or do I want to work in a clinic? And eventually, over time, kind of figured out that I could do both. And I think more programs are seeing the value of hiring on individuals that have clinical experience as well as research experience. And we're starting to see a shift in the focus of graduate programs, particularly in clinical exercise physiology. So that's one point. The other point I want to emphasize of Nicole's is getting into the clinics and seeing where you can work. Looking at CEPA's salary survey, 60 to 70% of CEPs are working in cardiac rehab. We know that. But there are so many other patient populations and programs, cancer oncology rehab, pulmonary rehab, all these patients benefit from working with clinical exercise physiologists. So you can read a textbook and understand the theory behind it, But what's more powerful is going to a program that increases your exposure to different types of structured exercise programs in different populations. So if you look up these programs, hold their feet to the fire and ask them which populations are you guaranteed that I'm going to work with, and which programs can I see and can I help run and be a part of.
To add on to that, something else you might want to consider. A lot of times students ask me these questions, but think about like what your lifestyle is and how the program is going to fit into that. As a 1 year professional program that doesn't require a research thesis, our students are either in class or in clinics most of the day from 8 to 5. And so if that is something that you don't see yourself being able to handle or being able to work with, then another program that might have research components, a little less structured, might be something that would be a better fit for you. Ask about whether or not you'll be working on weekends, and again, maybe even having night classes versus day classes. The size of the program, whether or not you're going to have a cohort of 12 individuals or you're going to have a cohort of 65 individuals, can definitely play into your preference. And then that preference would also help you potentially lead into your success as a student. Something also to consider is that by 2027, in order to sit for the national certification, students are going to have to graduate from an accredited program. So it'll be worth checking in to see if your university that you're pursuing is already accredited or pursuing accreditation. I know that that's still a few years away, but if you're not necessarily looking into a program for next year, that would be something to keep in mind for down the road, is looking at accreditation and different standards from there. Looking and asking if students take the national certification exam after graduating from these programs, what their first time pass rate would be, would also be something to really would be interesting for you, because if they have a low pass rate out of the exam, that might be something kind of a little red flag for you in regards to the program.
Thanks so much. We hit on so many areas. I feel like those are a lot of questions that students have as they're picking. So thank you. Moving right along to Brittany again. I know Nicole hit briefly on this, but what types of funding opportunities can you look for when pursuing a further education?
Yeah, so first of all, you got to realize that there's different programs out there. As Jamal and Nicole just mentioned, there's potentially 2 year programs out there that typically more traditionally require clinical and a research thesis to be completed, giving you exposure to the clinical world and the research world. Many times for many universities, those research theses and those appointments come along with a stipend and or an assistantship. So it's important to realize that that could include full tuition waiver, which is very good, especially to Nicole's point of not going into further student debt, but also a stipend. So you would be earning money in those positions, not only just getting the tuition waiver. So those are something to consider, whether or not the program has a tuition waiver and a stipend, or just one or the other. Um, a lot of programs coming up right now are being developed are also looking at what's called, at least in our institution, a professional graduate program, where we don't require research theses to be completed. Instead of 2 years, we're a 1 year program, which is beneficial because you can get into the workforce earlier. However, most of these 1 year programs are more than likely going to be a self-pay program. So to Nicole's point earlier, you might need to look to university aid. You might need to look and see if there are any type of assistantships in other departments outside of the program that you're specifically going into. So I know universities are kind of structuring themselves right now to offer one or the other, or maybe even both. So being able to kind of determine the degree of that. But back to another question that I get all the time from students: even if you don't get funding, will you be able to work while you are in grad school? That goes back to all the questions that we just reviewed when you're picking out a program. A lot of my current graduate students do work while in the program, so that helps offset some cost. Some other things to consider would be additional fees outside of just tuition and books. Ask yourself if the clinical experiences that you're obtaining are actually local to the university, or if you're going to have to be traveling and driving really far. Some universities will set up clinical experiences for you. I know that that was my experience as a grad student. I was very appreciative of that, just being told here's the hospital that you're going to work at, and the fitness center that you're going to work at. I didn't have to worry about that. I didn't have to find that on my own. Other universities just tell you to go find those experiences and make sure that you have a set number of hours before you graduate. And so that could be additional travel costs, that could be additional, that could be even, going off into another remote location, and doing your studies either online or at night kind of thing. So it's not only looking at the funding that's available through the individual program or the university, it's also thinking about the additional expenses, and whether or not you'd be able to work during the program to help offset those. So this is, a hot topic across the nation right now, student debt, and I think that it's an important one to really make sure that you're asking, and also asking upfront about the cost of tuition, to make sure that you have all of the information you need to really make a valued and smart decision for yourself.
To
Any
add to that
additional
just a
thoughts?
little bit, oh, sorry, go ahead. I was just going to add a little bit to that, to what Brittany was saying, that in addition, sometimes, in addition to the tuition fee, to the tuition and those, there are also other fees, maybe like the health center or computer labs, rec center, different things like that, that might be part of your fees that you might have to pay for that maybe you weren't told up front either. So they could be upwards to a couple $1,000s that may not be covered by an assistantship or that tuition waiver.
Wonderful. Any additions, Jamal? Fabulous. The next question is for you. So, if someone has decided to take a break in between undergrad and grad school, any tips for how to prepare for grad school in kind of that in between, thinking about, jobs, mentorships, professional organizations, or conferences to kind of attend?
Yeah. Well, first off, if you have decided to take a year off in between, good for you. Seriously, I think it's a very tough decision to be okay with for many individuals, where they may be getting pressure from some of their faculty, their classmates, friends, family. It's like, what do you want to do? Why don't you just go ahead and keep going, go to master's program, etc. It, I think it's helpful to take some time off just to be able to make sure that what you're passionate about is truly what you're passionate about. And what I've seen is that those individuals who've taken 1 year off, 4, 5, 10, 15 years off and decided to go back, they're the ones that truly appreciate the opportunities that are given to them. They're the ones that really want to soak up as much information and as many experiences as possible. And I think that's largely because once you get into the work life, this is a good thing. You are given a lot of responsibilities in the clinical exercise physiology world. They may be repetitive depending on where you work. And so the opportunity for growth may be relatively stagnant in some institutions, particularly if you have a bachelor's degree. Not to say that you're not capable of learning more, you truly are. Certain policies might just say, well, bachelor's prepared individuals have these tasks, master's prepared individuals get these additional tasks. And so if you find yourself where I feel like I'm kind of hitting the wall here, need more time or need more experiences to grow or specialize, then that graduate program is going to be something that you're just going to be thirsty for, and you're really going to take all full advantage of everything that you're offered. Now, to get back into school, that could be a challenge for most. One of the benefits of being in the work life and having a salary position, hourly position, is that you have a start time, you have an end time, and in many cases, you don't bring work home with you. You don't have to study, right? You have your tasks, and that's a very comfortable lifestyle. Getting back into academia, you have to take your coursework, you have to do your clinical experiences, and you have to study quite regularly. And so each night, if you're doing it the right way, you're probably doing a lot of reading, studying, homework, assignments, and getting back into the swing of that could be challenging. So I think psychologically and mentally preparing for that and making sure that you have great structure to accommodate for just the additional time it might take for you to get back into the swing of it would be good. Many individuals who have been working and have been getting a good salary and decide to go back to being students, it may be difficult to take that pay cut or not get paid at all. And so many individuals have to work while they're in school. So that's an additional challenge that would have to be considered. And if you are working and going to school, don't overdo it. Take the first year, don't take the full coursework and just see what that work life balance is going to be. And make sure that you have open and honest conversations with the program director, other faculty, maybe a mentor that you're paired up with. But I think you would be in a really good spot if you are returning back to school, because I think you're just going to want it more. You understand the value of it.
Coming from a personal experience, I'll be completely honest. When I was going through my academic career, I didn't even know a gap year was an option. I didn't realize that people did that. It wasn't until I got to the University of Delaware and realized just how many students took 1 year, 2 years, 3 years in between studies. And I very much support what Jamal just said, and the fact that that can be very beneficial, both to physical and mental and emotional health, to really gauge yourself and orient yourself before you jump into a commitment like graduate school. I will say we have had, as a program director, we've had many, many, many students come to our program from 1 year off, 2 years off. We also have older adult learners that have taken a decade off, as Jamal said. And honestly, personally, I haven't seen them struggle in any way different than our students that are coming straight out of undergrad. They're just as successful in getting positions and jobs. They're going through the program. Sometimes I think they might be even more successful, because they kind of have a different perspective and a different angle to approaching problems and work. And also, if they do have any experience from the workforce, they bring that in, and it's so refreshing to be able to have somebody in a cohort to be able to share real experiences, that students that are coming right out of undergrad might not have. So, as a student that takes some time off, you would be bringing a really unique perspective to a graduate program, and you can use that to your benefit, both as you go through the program, but also as you apply to a program. Talk about those experiences that you've had, the reasons for taking those gap years. It makes you stand out. It makes you different and unique, and it's something that program directors would definitely take into consideration with that as they look at your overall application. So yeah, the gap year or gap years can be very, very helpful, to help you in your academic pursuit.
As people are then taking that, both of you guys kind of hit on working, like get into the field, get a job. Um, any thoughts on ways to like connect with other individuals in the field while they're in that, to almost like continue learning in a non-traditional way other than just the job that they're doing?
Yeah, so it really depends on where you work. If you work at a teaching institution, they're likely going to have experts coming in to give presentations, so grand rounds and those types of things. So really seek those opportunities out, because that's completely free. You may not get continuing education credits for it, but you're getting a wealth of information. Additionally, many of these hospitals will have agreements with big journals, so that you don't have to get journal memberships from these big organizations. You can make use of their institutional agreements, go into their search engine, and look up the latest and greatest information in your field, where you're working or what you're interested in. If you can read, you can stay up to date with everything within your field that way. And then, I mean, connecting with Clinical Exercise Physiology Association, we're putting on wonderful seminars that are led by Sadie, and she's putting together just a wonderful lineup year after year. And they're all relevant to the practicing CEP. And so that is just another great way of, one, getting continuing education credits, but again, expanding your knowledge, your skill set, and being more prepared to help your patients achieve the goals that they've set for themselves and the goals that you've set for them.
I think one low-hanging fruit here too are conferences. We have differences in conferences, whether it's at the regional level or the national level. It's ironic. I was just having this conversation with students today. National conferences are great for networking, for expanding your knowledge, for just going and enjoying and being surrounded by science. Um, of course, they can be expensive and hard to travel to. So I really recommend individuals looking into their regional conferences. The fees to attend for a day or two are usually considerably lower than national conferences. You don't have to even be a member to join these regional conferences for the event. You get exposed to people that are close by you, which could also help with future networking or collaborations or discussions for potential guest speakers and such. And so I think that also keeping up to date with some of the events going on, whether it's ACSM, our virtual CEPA conference each year, the maybe AACBPR. So there's definitely a lot of opportunities for those type of resources. And since the pandemic, we have a lot more of those virtually accessible to us as well. So that cuts down on cost for travel and other expenses that are associated with actually going to the physical conference itself. And then on a less professional, or not even less professional, but maybe just something on the complete opposite side, would be social media. Journals, CEPA, ACSM, AACB, AACBPR, AHA, World Health Organization, all of these have social media accounts, and they will deliver information right to your door. They'll give you little tidbits of hot topics or new papers coming out. And so you can find out what you're interested by just following these accounts and then being able to click on their links, learn more, and then do a deeper dive into those research articles or those news articles or those postings once you kind of just figure out what you're really interested in. So social media is a really good resource for staying up to date on hot topics and also just kind of expanding your horizon in a very quick and easy manner.
To quick kind of go off of some of those points, I've had many people ask me if they have to be a CEP to join CEPA. And for many of those on here, maybe you're already a CEP and you joined in those things. But if you ever meet someone or someone connects with you that is not a CEP, but they want to become a member, it is not a requirement. So I always like to give that reminder. Um, we hit on a lot of topics that maybe even go into this next question. So this is for you, Nicole. If you have any additional tips for those not ready to get a grad degree right away, that was kind of our next question, which I know we hit on many topics there.
Yes, Jamal and Brittany did a great job hitting on several of the items that I was going to talk about in that section, specifically with the organization, CEPA, ACSM, AACVPR, as far as networking with those, the literature. I think also just trying to work in the field if at all possible, but if not, just being able to show those program directors and maybe even potential employers that you are working and maybe balancing life outside of there and whatever that might look like. Volunteering, observing, but maybe if you're feeling that you need some additional classes that maybe are a requirement for the graduate program that maybe you did not have as an undergrad, that could be an opportunity. So for an example, I'll use myself, my undergrad university, it was Mount Union College back then, now it's University of Mount Union, but I had 15 minutes of ECG or EKG. So when I came to grad school, that was a class that thankfully we had here at Ball State, but not all programs have that. And so some individuals may want to take a class online or somewhere else to be able to get that experience prior to going to a graduate program if that's an area that they just need a little bit more experience or expertise that way. I think those were the main things. Yeah, Brittany and Jamal did a great job covering everything else that I was going to talk about in that section.
Mhm. And I'd also encourage, if you are that person who's thinking, I just don't think I'm ready for grad school, explore why you feel that way. Why do you feel that you're not ready for it? You may be someone who has just debilitating imposter syndrome and you're really crushing it, but you just don't think that you're going to be able to handle the master's program. In that case, make sure that you have a mentor that you fully trust and they're going to be transparent with you. They know that if you ask, am I ready for grad school, that they would feel comfortable saying, no, you're not ready yet. And you know that when they say, yeah, you're totally ready, you got this, that should encourage you to think about it. It shouldn't stop you from looking at grad schools. I think it's always great to explore what's out there, what the expectations are, and so that when you do figure out, if you find out that, yeah, undergrad program I went to just didn't really prepare me for this, like Nicole was saying, now you know the courses that you need to take so that you can enter in and be successful in that master's program. So mentorship has just been transformative in my development as a person and a professional. So I highly recommend finding a good mentor so that they can help you with these very hard decisions.
Wonderful. So now we're kind of moving into some of those additional topics that aren't necessarily targeted to school, but in terms of your professional development. So first for Brittany, what is needed to qualify to sit for the CEP exam, and any tips in preparing for that?
Yeah, so it depends on if you have a bachelor's degree or a master's degree, to kind of start from the base and then move up as far as the qualifications go. So with a bachelor's degree, you need to make sure that that degree is housed in a exercise science, exercise physiology, kinesiology, or related field. You will also need 1,200 hours of clinical experience. Whereas if you have a master's degree, again, related to kinesiology, exercise physiology, or something along those lines, you need 600 hours of hands on clinical experience. So the master's degree is helpful in the sense that it furthers your education, as we were discussing earlier. However, it also helps cut down on those required hours that are needed in order to sit for the national certification exam. It's important to know that those hours that are required must be specific to exercise physiology and clinical exphys. They can't be with observing a chiropractor or an occupational therapist. They don't ACSM does not recognize hours spent in physical therapy clinics. So I know a lot of students will get observational hours or volunteer hours in those settings. These need to be settings that are specific to clinical exercise physiology. So think your cardiac rehab, your pulmonary rehab, a medical fitness facility, a phase 3 or step down program. So it's really important as you move forward, if this is a goal for you, to not only know and align your academic preparation, but to also make sure that the clinical time that you're spending is going to be is going to count, and it's going to be credited towards those 600 or those 1,200 hours that are required. In addition, you'll need to send your transcripts. So the program will need to be approved and the coursework needs to be approved by ACSM. Again, 2027, it's going to have to come from an accredited program. At this time leading up to that, you'll send transcripts. You might even have to send a description of the courses that you've taken. So that would come from your course catalogs located on your university's website. But all of that information goes into your application. The application will also require you to have BLS training. Basic life support is required. And then you also need to make sure that by 2027, you have first aid training as well. So there's a few big kind of mile markers coming with changes by 2027. But the big ones are clinical hours, a approved academic coursework, and then that BLS and or first aid training. You'll complete an application that you can find online. It requires you to put your supervisor's information name, the number of hours you obtained, the site location that you were at, and then also a description of the patients that you worked at, the tasks that you performed, what you observed, what was hands-on. All of those are independently reviewed by the team at ACSM, and then once approved, they send you a code to be able to actually register for the exam. So in addition to doing all of your homework homework about what university you want to go to, what program you want to pick, the pros and cons between a 1-year program and a 2-year program. There's even more that you have to think about because you want to make sure that your academic and clinical preparations throughout your grad program result in something. And that something is usually either a job or a job and a certification. And so specifically to that certification, you really want to make sure that everything that you're doing in those years, studying and working really hard, will lead up to those qualifications. If you have any questions about what does count or doesn't count, you can reach out to the team at ACSM. They're very responsive, very helpful, and they will make sure that they really steer you in the right direction. And so this is definitely not just something that you can sign up for on a whim and just go for it. You really need to make sure that you're taking the steps along the way to set yourself up for being qualified and also for being successful on the exam. There's an entire exam content outline that outlines everything that you can expect, the different domains ranging from exercise leadership to exercise prescription, exercise testing, behavior, legal, health history assessments. I'm sure I'm forgetting something right now, but that document is incredibly thorough. It breaks down exactly what sections are on the exam. It also will help you identify the very nitty-gritty information that you can expect as far as, medications that you might want to focus on, types of physical assessments to focus on, types of health history questions. And they also have on the website some good tools and review courses, as well as their books and recommended study material. So there's definitely a lot to consider with the national certification exam, but once you have that, it makes you an incredibly qualified candidates for those jobs that we were talking about earlier on. It also gives you the ground to stand on and show the world that you have done all this hard work and that you know everything that you've worked so hard to. So if I forgot anything, please chime in.
I think that was great. Someone had even asked why it was important to get the CEP, and then they told me that, oh, you answered the question. So good work. Our final kind of question, then we'll get into the Q&A, and I'm going to ask this to Jamal and even kind of put in one of the questions with it because it's related. But what is a doctorate of clinical exercise physiology and who should pursue the degree? And then kind of a tagging onto there, if you can hit on what are the benefits of pursuing this professional degree as opposed to a PhD or a doctorate of education as someone's kind of deciding.
Yeah, I'm glad you brought that part up because the DCEP program, the Doctor of Clinical Exercise Physiology, it's not a PhD. PhD, you're doing a dissertation, very heavily focused on scientific method, being able to write grants, write manuscripts, design studies, manage and run studies, et cetera, et cetera. The DCEP program is purely professional. So I think a great comparator would be a DPT, Doctor of Physical Therapy, a DOT, Doctor of Occupational Therapy. They're learning how to be effective practitioners. And this is what the DCEP is essentially modeled off of. I work in a physical therapy department, ironically, but I have a very supportive program director, department head, Ross Arena, who considers himself a clinical exercise physiologist as well, that understood the benefit of pursuing this type of education. Now, who should do this, or do you really need this to work as a clinical exercise physiologist? No, I'll be honest with you. You can have a bachelor's degree, a master's degree as it stands right now, and find employment. This program is specifically for individuals that have a master's degree. I'll get into the details for what makes you eligible in a little bit, but for individuals who have a master's degree, they're working in the field and they feel like they just have hit the ceiling again, that there's so many more things that they want to learn, new experiences, leadership qualities. And so this is what that DCEP program is essentially modeled off of, or that idea and that need. And so an individual has to have a master's degree in exercise physiology, clinical exercise physiology. They've had to take ECG and be able to interpret resting and exercising ECGs, understand advanced exercise physiology, clinical exercise physiology coursework, and at least 100 hours of clinical experience through an internship. The reason why we set that bar relatively low is because we know that some programs don't offer a lot of hours. And so we want to be mindful of those individuals that are coming in. The program itself assumes that you understand cardiovascular physiology, how to work in cardiac rehab programs, basic exercise prescription, monitoring, and it's going to go to the next level. So one of the main areas that we found the need to expose students to is the world of diabetes care and education specialists. There's currently only, I think, 26 CDCESs, so Certified Diabetes Care and Exercise Specialists in the United States as CEPs. They're mostly nurses, dietitians, and so there's a huge need for certified diabetes educators that are clinical exercise physiologists. We see this in our clinic. We see this from the main accrediting program or the organization that has these certifications. They've come to us and say, we need more CEPs. And so there are dedicated coursework and experiences so that you can manage patients with type 1, type 2 diabetes, understand which medications would need to change, and provide that guidance as a certified CDCES. Our students learn how to perform echograms, whether it's at rest, and we're kind of exploring exercise echoes as well. But that is another area that a lot of research groups have a lot of involvement in, a lot of vascular imaging, cardiac imaging. And so we've had a number of patients or a number of students that have gone into the research world and have left with that skill set and are now able to run those scans for those larger research trials. That course prepares them to become point of care ultrasound specialists. And so they become certified, they can do echoes in the emergency room, private treatment rooms, etc. And then there are many more, but I know we're running out of time here. The other major component is preparing students to become leaders, not only within the field, but specifically in clinics. So now we have program directors of cardiac rehab programs. We have individuals that are directors of master's programs that have graduated from our DCEP program. So it's preparing individuals to take on more responsibilities, gain more skills, more knowledge, and really open up the world of clinical exercise physiology and help influence that direction that we're moving as a profession.
Yeah, I think that's great. So the focus mainly in choosing this degree, you would say, versus the PhD, ED route is you want to be more of a leader in that clinical realm, or some of these additional, further education areas within the field to really specialize, or get those specialty certifications.
Yes, and I've come across a lot of individuals before the DCEP was created and when I was kind of talking about the concept, and they felt like this is what I need because I don't want to go for a PhD. I don't want to write, study, or do grants, research, etc. I want to stay in the clinical world. So it is for those that want to stay in the clinical world.
Thank you. This is one of our other questions. So someone had a specific question. They're currently a corrective exercise specialist, but they never had clinical experience. And so what's the best way to transition into this area and gain experience when they don't have previous experience to offer?
So I'm not familiar with what corrective exercise physiologists are or what they do. I'm imagining, well, I won't even guess. I don't want to be wrong here. But I think the best way of getting experience is to reaching out to programs that are around you in that area. So again, 60, 70% of CEPs are working in cardiac rehab. That's a wonderful place to start because those programs are eager to hire on interns or additional help, and they're really willing to kind of teach you the ropes of all there is for clinical exercise physiology.
A corrective exercise specialist is a NASM certification. So it's like an additional class that they can take on top of being like a personal trainer.
Yeah,
But
I
yeah,
will say it's a great question. I will say it's going to be challenging to just kind of get experience um, without being enrolled in a program or without having networking or without having some type of connection. Um, due to many different factors such as liability issues from a hospital or a clinic. Could be just room, because some of these hospitals already have contracts or connections and networks with academic programs. That is a big benefit to being enrolled into an undergraduate or specifically a graduate program, is having kind of that piece of the puzzle put together for you. And as far as graduate experience goes, for the master's level, a lot of programs, like even mine, we don't require you to have any prior experience coming into the program. That's what we're here for. We want to help you earn that and supervise you as you get that. But for the DSEP, you would have to have that master's already, so that it would kind of take out that concern or that worry for you if that was your ultimate goal. But yeah, it is very challenging to be able to get clinical experience without having that establishment or that academic connection to be able to help you with that.
Another good question we have, this is kind of two parts into one. Kind of how is a good way to start searching for opportunities to get an internship specifically in cardiac rehab or non-invasive cardiac diagnostics? And what are the core skills to then go in and do that job well, like that internship well?
Yeah, CEPA has an internship directory, so that would be, I think, a good place to look first to see if there are programs around you. And then after that, honestly, a Google search of cardiac rehab programs in your city can start that process. As far as skills go, it really is dependent on the facility and what they are expecting and what they're going to teach you. But the critical skills that you're able to take blood pressures at rest and especially at exercise. That is a must. So if you have the opportunity to train on that, become proficient, that's going to help that transition into those clinical internships. But many of these internship sites, they understand that you may not have had exposure to that, so they'll help you get those skills up. And then all of the finer details, of course, with monitoring different types of patients, different conditions, understanding glucose levels, diabetes, etc. Those are all going to be things that the internship should help you become successful in working with those patients.
And I will say that if you are going to go and start reaching out to individuals in hopes of getting an internship, make sure that your communications are aggressively professional. Make sure that you introduce yourself. If you're doing it in person, make sure that you are presenting yourself as a professional. Make sure that your writing is clear. Make sure that the individual knows who you are and what the purpose of the email or the phone call is. That is going to be your first impression, or that's going to be their first impression of you. So it's already challenging enough to get into the internship space. But if you do start to reach out to these places, whether you find them in your local area or using the directory, please make sure that your communications are very, very professional to help give you the best leg up and the best chance of getting that spot.
Someone asked if the DSEP program will always be in person or if there will ever be a hybrid version.
Yeah, we've had that question a few times. We are truly considering providing a hybrid option. As it stands right now, in the near future, it's going to remain as an in-person option. But we are, as we're going through each one of these years, planning for a hybrid option.
And is there any assistantship at your organization for that program, since that varies versus people doing PhDs or EDDs?
Yeah, it's a little difficult within our college. So a lot of our grad programs do not provide assistantships. It is you have to pay tuition. And then what we've done this year is we've opened it up to a 2-year experience. So typically it's 1 year, but we have an individual who's doing the 2-year option so that they can have a part-time job and go through the program. And so it has been working out well for them. So it makes it much more financially feasible. Another incentive to potentially pursue that if you wish, the salary that we've seen so far, the range for an annual salary is the minimum 80,000, and then the highest that we've seen so far is 135,000 straight out of the DCEP program. We can't guarantee that you're going to be making that, but out of the individuals that have graduated, they fall between those two figures. So we're quite confident that the salary will reflect the degree and the training and the experience.
The last question we had, and any of you guys can answer, but I'm also happy to chime in on this one. They asked if we could speak about the cancer specialist certification that ACSM just started offering. I took it and I thought it was fabulous. I was lucky enough to have a previous certified cancer exercise specialist certification through an internship, but only so many people can go get internships like that. So I think that this has been really great to open it up. And when they built that new course, they've really tried to update since we've had so much research in this area. But I think in talking about specialty certifications in general, I think that this is a great way for anyone to further their education, especially as we see some of these more specialized programs. So cancer is one example. But also our November webinar is going to be on autism and exercise. And so there's now a certification for that. And so I think ACSM does a really great job, but these professional organizations with their webinars, it's not a certification, but it is continuing education. So any opportunity you have to delve deeper into the education of these specialty populations, I think is important. Any last thoughts, and then we'll kind of close up. I know we're right at the end of our time.
I know I could probably speak for everyone here, but Sadie, if there's a way of providing emails, I'm always happy to answer any emails, questions that come our way.
Yeah, I can have in the follow-up email when we send out the recording, I'll make sure that contact information is included. Wonderful. Thank you again to our panelists. Thank you to our attendees. You had some wonderful questions. We hit on a lot of different topics, and I really do think connecting with those who've had these different journeys or in different, parts of the U.S. is huge because you can get stuck at all different parts of this process. So thanks for being a part of this. If you're an educator and you want to share this with your students, definitely do. The more information we can get out there to people, the better. So I hope you all enjoy the rest of your evening. And like I said, we're going to have another great webinar in November before we kind of close out our year for education. And then come January, we're going to do the free webinar again with continuing education credit included in that. So get excited for January, and then February, always that annual conference. So big things coming for education for CEPA. Have a wonderful evening, and we hope to see you again.